Hello everyone, and welcome back to our channel. I'm Bonnie, and today we're going to explore the key factors that influence oral drug absorption. Oral drug absorption is a complex process influenced by various physiological and biochemical factors. Understanding these factors is crucial for optimizing drug efficacy and ensuring that medications work as intended. In this video, we'll delve into 5 major factors that affect oral drug absorption: pH, blood flow, total surface area, contact time, and p-glycoproteins. We'll discuss how the pH levels in different parts of the gastrointestinal tract can impact drug solubility and absorption. We'll also look at the role of blood flow in transporting absorbed drugs to the systemic circulation. Additionally, we'll explore how the total surface area available for absorption, the contact time of the drug with the absorption site, and the presence of p-glycoproteins, which can pump drugs out of cells, all play significant roles in determining how effectively a drug is absorbed. So, let's dive in and uncover the science behind these factors and their impact on oral drug absorption. Most drugs exist as weak acids or weak bases. When weak acids or bases dissolve in the gastrointestinal tract, they dissociate and establish an equilibrium between their unionized or uncharged form and their ionized or charged form. The ionized species of a drug is more water-soluble than the unionized species. However, the unionized form is more lipid-soluble. Drugs that are lipid-soluble tend to traverse cell membranes more easily. Therefore, the extent of drug ionization is an important factor in absorption. The extent of ionization is dependent on the pK of a drug and the pH of the medium in which the drug is dissolved. For example, in acidic environments, such as the stomach, which has a pH of 1.2, weak acids exist predominantly in their unionized form and are able to cross the cell membranes more easily. However, for weak bases, the extent of ionization increases and less unionized drug is available to cross the cell membrane. In less acidic environments, such as the colon, which has a pH of 5.5 to 7, the extent of ionization of weak acids increases and less unionized drug is available to cross the cell membrane. However, the extent of ionization of weak bases is reduced and more unionized drug is available for absorption. In addition to the equilibrium between the ionized and unionized forms of the weak acid or base, there is also an equilibrium between the concentration of drug in the gastrointestinal tract and in the plasma. However, the total drug concentrations either side of the cell membrane can be different at equilibrium if the pH of the medium differs either side of the membrane. For example, a weak acid with a pK of 3 is primarily unionized when in gastric fluid, which has a pH of 1.2. However, once the unionized weak acid passes into the plasma, which has a pH of 7.4, it becomes extensively ionized. This creates sink conditions, where unionized weak acid will be rapidly absorbed from the gastrointestinal tract to maintain the equilibrium in unionized weak acid concentrations between the gastric fluid and plasma. The blood flow to the gastrointestinal tract is important for carrying absorbed medications into the systemic circulation. A large network of capillaries and lymphatic vessels perfuse the duodenum and peritoneum, with the splanchnic circulation receiving approximately 28% of the cardiac output, which is increased after meals. The high degree of blood flow helps to maintain a concentration gradient to facilitate rapid passive diffusion. However, conditions that decrease mesenteric blood flow, such as congestive heart failure and septic shock, will decrease the rate that drugs are moved into the systemic circulation. Consequently, this decreases the concentration gradient and rate of drug absorption. These conditions can also reduce the absorption of drugs rectally and transdermally. Most oral drugs are absorbed from the small intestine, particularly the duodenum, due to its unique anatomy that provides a huge area for a drug to passively diffuse. There are 3 mechanisms that increase the surface area of the small intestine, including the folds of Kerckring, which are valve-like folds in the mucous membrane, villi, which are small projections from the folds, and microvilli, which are even smaller projections that form a brush border. Conditions such as inflammatory bowel disease, celiac disease, and gastroenteritis can damage the villi and microvilli, decreasing the total surface area. Consequently, absorption will be reduced. Normal peristaltic movements of the gastrointestinal tract bring the drug particles in contact with the intestinal mucosal cells. Sufficient contact between the drug and these cells, residence time, optimizes absorption. Conditions that increase the motility of the intestine, such as diarrhea, will reduce the drug's residence time, thus reduce absorption. P-glycoproteins, also known as PGP, are energy-dependent, membrane-bound proteins which act as an efflux transporter. It transports compounds from inside the cell back into the intestinal lumen, thus reducing drug absorption. PGP are also expressed in other tissues, such as the blood-brain barrier, liver, and kidneys. In these locations, they limit drug penetration into these organs. Many drugs are substrates of both PGP and CYP3A or can induce or inhibit both. Therefore, the extent of the interaction is often due to the combined effects on PGP and CYP3A. Generally, interactions involving PGP on their own are not clinically important, except for situations where the drug has a narrow therapeutic index and PGP is important for its distribution, such as digoxin and cyclosporin. Furthermore, it is difficult to predict the likelihood of PGP effects on absorption as there is significant individual variation in the expression of PGP due to genetic differences. Further research to better understand drug interactions involving PGP is required. Thank you for watching. I hope this video helped you understand the various factors that affect oral drug absorption. To recap, drug absorption depends on its ability to dissolve in the GI fluid and move across the GI lining. The pH levels in different parts of the GI tract can affect the ionization of weak acids and bases, impacting their absorption. While ionization may be necessary to facilitate the dissolution of these drugs, only the unionized form can cross the GI membrane. Conditions that impair blood flow, such as shock, can reduce oral absorption. Similarly, conditions that damage the surface of the intestines, like inflammatory bowel disease or decreased transit time, can also decrease absorption. PGP is an efflux transporter that can reduce the absorption of medications. Although blocking PGP can theoretically increase drug availability, these interactions are rarely clinically significant on their own. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more insights. In our next video, we'll be discussing the important topic of bioavailability, so make sure to hit the notification bell to stay updated. Until then, take care and stay informed.